Buenos días, buenas tardes.
All right, so maybe we get
Queremos
started.
agradecer, ante todo,
Good
les
day,
agradezco porque
good
esta es una
afternoon.
oportunidad
It's
que
a
las
pleasure
tenemos
to be
para,
here. I
para
thank you because these are
transmitir
very
las
busy days for
reuniones
everybody.
de Clacai
So we
para hacer
appreciate here
sumar
from
este
Clacai
encuentro
to add
a
to this
este
encounter, to this
encuentro global,
global
impulsado
forum
por
promoted
Clacai, la red
by
jurídica de
Clacai,
Clacai, de la mano de la
the Clacai Legal
Asociación
Network,
de Ríos, Web,
by,
IPAS,
by Rios, Web,
Optio, Centro
IPAS,
Global
Optio, the
Reproductivo,
Center for Reproductive
la Red Global de
Rights,
Mujeres por los
the
Derechos
Global Network for Women for Reproductive
Sociofeministas y la Red de
Rights,
Salud de Mujeres
uh,
Latinoamericanas y del
for feminist
Caribe, que
and
inició
Latin American and Caribbean
conversaciones con
Women's
primero
Network.
fueron
The first
con
conversations
Sandra
we
y con
had
Daniela,
was
que
were
las
between Sandra and
coordinadoras del
Silalina.
taller.
So thank you
Si
for
alguien
thinking of this.
no
If
está entendiendo
anybody isn't understanding
or
this
having a
because of the
time or
language,
having a problem with the translation, please put a message in the chat. Em, bueno, sin más vamos a arrancar porque tenemos
all
que
right, so
dar
let's get
noticias para
going
todo el
because
mundo,
we
queremos
have
conversar sobre todo el mundo
everybody
y
wants to
esto
be
es
able to
eh,
have
muy,
conversation, and
muy
so
exigente. Entonces,
it's very
eh,
demanding time wise. So
Sandra, Susana Chávez
Sandra,
lamenta que
Susana
haya
Susana
de
Chavez sends her
volver,
apologies. She
entonces no
is
puede
on a trip.
de
She's
ser parte.
in the air right now,
Susana
so she can't
Chávez,
join.
con
Susana
George y
Chavez,
yo, Agustina Ramón y yo,
together with
hacemos parte
George,
de la dirección
we
de
are part of
Clacai, de este
the
consorcio
direction
latinoamericano.
the board at
Antes de
Clacai,
darle la
this Latin
palabra
American consortium.
a las
Before
panelistas, quisiera
giving the
que
floor
Sandra
to the panelists, I would like
salude, Sandra
Sandra
Castañeda.
to greet us. Sandra Castañeda, say a few words.
¿Querés desmutearte, Sandra?
Do you want to unmute, Sandra?
Gracias, gracias Agustina. Un saludo, bueno, queremos saludar a
Thank
todas
you,
las personas
Agustina.
que hoy
Well,
se
I would like to
conectan.
greet all the
Muchas
people
gracias a
connecting
Clacai,
today. Thank you very
especialmente
much
a
to
Agustina
Clacai,
Ramón y a
especially to
Yalinda
Agustina Ramon
Datembrache,
and
que
Jalina
han tenido
Datembrachik,
esta
who have
maravillosa idea de
been
juntarnos
had this wonderful
desde
idea
distintos rincones del mundo para
of
celebrar este
getting people
28
together from all over the
Día
world to celebrate
Global de la
this
Despenalización del Aborto,
September
que en últimas es
28th,
también el
the
Día de la
global
Mujer
day
Libre
of
y el Día de la
decriminalizing
Libertad
of
de las
abortion,
mujeres
is
para
a day of
decidir sobre
freedom
nuestra
for women
sexualidad, sobre nuestra
on
reproducción
deciding
y
over
entre
our
los
sexuality and
universales
reproduction,
poder
which
decidir sobre nuestra
definitely
salud y
has to
sobre
do with
nuestra
being able
vida.
to decide
Este
over our
28 de
health and our
septiembre
life. This
nos va a
September
tocar un momento
28th
muy crítico. Hoy
gets
más
us
que
at a
nunca,
very
estos
critical
espacios de
juncture.
convergencia
All the
son
more
muy
so these
importantes,
days,
cobran
these spaces for
mayor
convergence are very
relevancia
important. They become
porque
very
nos
relevant
encontramos ante
because
una crisis
we
de
find
distintas
ourselves faced
dimensiones.
with a crisis in
Todos
many
sabemos que hace un
dimensions.
par de
We
meses
all know
salió
that a
el
couple of months
informe
ago, the
global
report came
de
out, the global
embarazo y
report
fertilidad en el mundo.
on
Los datos de este
fecundity in
informe
the
nos han
world and
mostrado
this
cifras
infertility in the world,
que
and
son
these information
muy
has shown us
reveladoras sobre la
very
situación de las
revealing
mujeres y
numbers
sobre la
on
necesidad que
women
tenemos de
and
cada
the
día
need we
tener
have
más autonomía,
to more and
de
more
tener
have
más
more
capacidad de
autonomy
decidir sobre
over
nuestra sexualidad y sobre nuestra
ourselves and our
reproducción.
sexuality, our
En este
reproduction.
informe
So
encontramos
in
unas
this
cifras que
report, we found
muestran, por
numbers
ejemplo, de
that
que una
speak
de
of,
cada
for
cinco
example, that
mujeres
one out of every
de
five
hoy
women
tiene menos de
that
50 años
is under 50 today
no tiene la posibilidad
doesn't
o
have
tiene
the
la expectativa
possibility
de no
is
poder formar
or
la
isn't able
familia que
to
quisiera
build the family she
porque
would
hay
like
muchas situaciones y
because
muchas
there are
limitaciones
too
que
many
no se le
situations and
permiten.
limitations that don't
No
allow her to,
solamente razones
not
relacionadas con su
just
vida profesional
related to her
con barreras
professional life
profesionales,
or to
tiene
personal
que ver
barriers.
con las
It has to
condiciones
do
sociales,
with
políticas y
the
económicas que
social,
el sistema
political,
les
and
provee.
economic
Hay
conditions that the system
limitaciones
provides.
a nivel
There
de
are
los ingresos,
limitations as
de
far
la
as
precariedad de los
income,
empleos, de
how
los costos de
precarious
la
employment
vivienda, el
is, the
acceso
cost of
desigual a los servicios de
housing,
salud reproductiva y a la calidad de esto.
reproductive health, and the
Las
like. So,
normas y los estereotipos de género que cargan a las
regulations
mujeres con
and
todo el trabajo
gender
del cuidado y
stereotypes
sobre todo
that
el
burden
miedo al
women
futuro. Hoy
with all the
estamos
work and
asistiendo
fear of the
precisamente en la
future.
Asamblea
So
General de Naciones
today
Unidas que está
we are
sucediendo.
within the framework
Estamos
of
viendo
the
el
assembly
debilitamiento
of the UN. We are
debilitamiento de nuestros
seeing the
sistemas,
weakening
el
of our democracies, the
debilitamiento
weakening of
de
our
las
systems, the
relaciones
weakening and
internacionales, lo cual
delegitimization
está
of the
llevando
multilateral
justamente
systems
al fracaso de
are
las
leading
instituciones
not
que
just to the
creímos
failure of
permitieron
institutions that we
mantener la
thought were the
sostenibilidad de
ones
la
that were
vida
going to
por muchos
keep life
años más,
sustainable for
sino que
many more
están
years,
poniendo
but
en
they
riesgo
are
la vida,
putting
el
in
bienestar
danger
de millones
life
personas,
and the
además de
well-being of
los de la
millions of
guerra,
people, in
además
addition
del
to
genocidio que está
the
sucediendo en
wars and
Gaza,
the
contra el
genocide
cual
that
es
is happening in
importante que
Gaza,
levantemos la voz. Estamos viendo
vis-a-vis
hoy
which
más que
it's
nunca
important for us to
mujeres
raise our
necesitamos
voices. We're
más
seeing
autonomía
that more and
en nuestra
more
reproducción,
women,
en
and
nuestra
we need
reproducción.
more
Las
autonomy over
mujeres
our bodies
jóvenes
and
han
reproduction.
mostrado en las distintas encuestas
Young women
que
have
tienen
shown in
miedo al
different
futuro,
surveys that
que el
they are
cambio
afraid of the
climático, que
future,
los conflictos,
that
las guerras, la incertidumbre
conflicts,
global que estamos
war,
teniendo en este momento
global uncertainty we're living
están
currently
llevando a que las
are
personas cambien la
leading to
perspectiva
people
que tienen
changing
sobre su vida
and
al futuro.
to
Así
on the
que
perspectives that
nosotras como organizaciones que
they have
defendemos
on
la
their
democracia,
lives. And
que
so all of us
defendemos
who
el Estado laico, que
defend
defendemos los
democracy and who
derechos humanos,
defend
esta causa
the
es una
state,
causa que va mucho más allá
and
de la despenalización del aborto, es una
we
causa que va hacia
go way
abrazar
beyond
ese cambio de
decriminalizing
vida
abortion.
en
We
las
want to
sociedades que tienen
embrace
sobre todo las
the
mujeres jóvenes y las
the
mujeres en edad
project for life
reproductiva,
that
que
young
necesitan
women
servir
women in
ese
reproductive
proyecto de
age
vida
have.
que se necesita en
The
estos momentos tan
we
críticos.
want them to be able to
Yo creo
rebuild their dreams and
en
aspirations for
particular.
life
Gracias por
at such an
reunirnos,
important
gracias por
juncture. So we think it's
escucharnos,
very
gracias por
important.
los
Thank you
aportes que
for
vamos a recibir
gathering us.
y
Thank you
esperamos
for
que
the
podamos seguir trabajando juntas
words that we
porque
will
esto es lo
be
que
hearing.
necesitamos
And I
políticas
hope we continue
que
working together
clamen este
because this is
momento.
what the
Gracias.
political times are demanding of us.
Muy
Thank you.
bien. Vamos a grabar, Mariana,
All right. So we're going to
Sí, buenos días, se está grabando.
record, right? Yeah, good morning. Yes, it's recording.
muy bien.
Okay, very well.
Hay tres preguntas que
There are
organizan
three
este
questions that
encuentro para
organize
que
this gathering
panelistas
so that
hablen sobre una
five
región, una región
panelists talk about
mundial.
a region,
Incluso
a very
una tiene
large
un
region.
significado a
In
nivel
fact, one
global.
of the panelists has a global
Estos son
outlook.
permisos que uno debe
So
tomar porque sabemos que
these are
siempre es más
liberties
complicado,
one takes because we know it's
pero que tiene sentido
harder
pensar a partir
to encompass everything, but it
de
makes sense to
conversación
think
porque
of
puede
regions
hacer pensar en metas comunes e incluso
because it
estrategias
leads us
comunes.
to think about common
Entonces, las tres
goals and common
preguntas son,
strategies. So the three
¿cuáles son los
questions
principales
are:
desafíos que
what are the
enfrentan
key
a cada una de las
challenges that you
regiones?
find in each of the
¿Cuáles son los
regions?
horizontes que se
What
ven?
are the
Y la
horizons you see?
tercera tiene que ver a
And the
cómo
third has to do
podemos
with
seguir
how
impulsando
to promote and continue promoting
visiones colectivas donde
collective
hay
strategies and
tendencias
visions
más de
where
meterse para adentro, más individualistas, a pensar,
where the
porque estamos
we
abrumados
try
de
to
problemas
transition
en
from
cada uno de nuestros
individualism because
países,
sometimes we're overwhelmed
etcétera,
with problems in each
cómo
of our
recuperamos
countries.
impulso
So how to
colectivo
remember
e
that
impulso
joint,
global.
that
Estas
collective
son las
impulse and that
preguntas que
global impulse? So
queríamos
those are the three questions that
presentarles
organize this
y voy
panel.
a presentar a
And I
nuestros
am going to
panelistas de hoy.
present our panelists for today.
Y antes que todo voy a
And
hablar y voy a
before
pedir
all
disculpas
that,
porque voy a
I
hablar
would
en
like to
portugués y
apologize
espero
ahead
que
of
no
time
se
because
interprete.
I'll
¿Sí?
probably get the pronunciation wrong.
Primero, con el gran
First,
desafío de presentar una perspectiva
I
mundial,
have, with
tenemos
the great
a
challenge of giving a
Devanjana
global perspective, we
Suduri,
have
directora
Evanjana
ejecutiva de
Suduri,
la Red
uh,
Global de
Executive
Mujeres por los
Director
Derechos
of
Reproductivos.
Women for Reproductive
Eh,
Rights.
esta red es
This
la que coordina
network
la campaña del
is the
28 de
one that
septiembre. Como
promotes
ustedes
the
saben,
September
acceso a
28th
aborto
campaign,
legal,
access, as you all
seguro
know,
y
access
que
to
por la
legal,
región
safe abortion.
africana va a
And
presentar
then for the
Lily
African
Sharon
region, we'll have
Pamela
Lily
de la
Sharon,
Organización
Pamela from the
Afisa Nahaki de África,
Official
del
Nasaki
Instituto de
Association from
Investigación
Africa, which is a
y
research
Capacitación
and
Citizen
training
Focused,
institute that
afrocéntrico, para
uses Afrocentric
conocimiento y mejorar
approaches to create
liberalización reproductiva.
knowledge and improve reproductive
Después
rights
seguimos por
and
Asia.
sexual rights. Then we
Tenemos
have for
a
Asia, we have for
Sai
Asia, we have
Rachela,
Sai
que es la directora
Rachela, who
ejecutiva
is
de
the
ARO.
executive director for Arrow.
Gracias. ARO
Thank
se
you.
esfuerza por permitir que
Arrow
las mujeres y las
is
personas no
making an effort
binarias
to
puedan
allowing
acceder también al derecho
non-binary women to also
reproductivo. Fue
have
fundada en
access to
1993
reproductive rights.
y tiene
Uh,
sede en Kuala Lumpur, en Malasia.
it's based out of
Después
Kuala Lumpur.
seguimos con la región
And
europea,
then we continue with the European region.
que viene en representación del Centro de Derechos
Georgiana Epure,
Reproductivos
who is
de la
representative for
región
the Center for the Reproductive
Europa
Rights
del Este
in
Central,
the
y ahí hablaremos de
Eastern and Central
Cristina,
Europe
a
section. And
Cristina
we would
Rosero y a
also
todo el equipo de
have
derechos
asked,
reproductivos
well, thank
que
Cristina
hacen
Rosero and the
posible
whole Center for the Reproductive Rights for
este
having
contacto. Y
helped
en
us with this contact.
representación de
And
la
in
región
representation, or to
región
represent the
latinoamericana,
Latin
tenemos a
American
Inalina
vision, we have
Calle, que es la
Inalina,
coordinadora de la red jurídica
who
Clacai,
is
el proceso
coordinator for the
latinoamericano
Clacai
contra
Coordinating Network, which is the Latin American Consortium for Abortion Rights. And it gathers around 700 organizations of different kinds in Latin America who work on abortion. And then lastly, we have from North America, Rebecca Reingold, who is representing a friend of the friends of the house here, people who've been working with us for a very long time. So if we start with the order that I mentioned, if you forgot it, I can always remind you as we go along. So we'll start with the global perspective. Banjana? Oh, sorry.
Yeah. Hi, good evening, everyone from India. I'm joining from India today, and thank you so much, Clacai, for having me here and this wonderful conversation that all of us would be having. I'm Debanjana. Thank you so much for the kind introduction. I'll start a little bit about what we do at WGNRR and how we commemorate September 28th. So, Women's Global Network for Reproductive Rights is a global South NGO working on advancing SRHR for all. We work in order to improve access to safe abortion, advocate for sexual and reproductive rights and justice, young people's empowerment, and young persons' agency, bodily rights, and autonomy. We center justice and feminist principles and feminist values at all the work that we do. A little bit about how we come up with September 28th and all the wonderful voices that we are able to gather and the solidarity movement we are able to co-work on is that we co-create, co-develop, and commemorate September 28th International Day for on Action for Safe Abortion, and also May 28th International Day for Action on Women's Health. What we typically do is we have a lot of partners, we have a lot of voices from the global South as well as from the North in order to contribute to the emerging themes. The themes that we develop, they emerge from the conversations that we have with various voices, diverse voices that we hear. I'll share a bit about the Asian context first. In Asia, access to abortion is riddled with many challenges. There are repressive laws and policies in a few countries, and then there are complete ban on abortions in countries like the Philippines. And then there are countries like India, Bangladesh, Nepal, where there are conditional access. And then there are certain countries like Pakistan where we have conditional access, or we need to talk about abortion in post-abortion care language. We are not able to talk about safe abortion or safe abortion access directly. In a setting like this, there is a need to address stigma, taboo through conversations, community engagement. And what we do at WGNRR very well is artivism. We work with a host of artists, young artists, and also feminist artists, and we develop content which could be in form of music, spoken poetry, murals in order to address stigma and taboo. A bit again about the Asian context, it's a region where patriarchy is riddled in societal norms. Everything that we talk about bodily rights has a patriarchal conversation that happens in the backdrop, and patriarchy often impedes access for each one of us. So, for our movements, in the Asian context, in the countries that we work in Asia, is that we work with our partners in certain areas, and then there are areas countries where we work directly, and we work with policymakers, multi-stakeholders to have policy level changes for legal and safe abortion, also to raise awareness amongst the public, the mass, to demystify myths around abortion, to demystify myths around bodily autonomy. But the work is hard because right now, as Sandra really mentioned, not just that there are myths that are there, but also the growing opposition. And now we can't actually call it growing anymore. It is a full-grown anti-choice, anti-rights work that is happening in each of the countries that we work. In the countries that we work in Africa, in certain countries, we do have medical abortion provision. In certain countries like Benin, we have an excellent law But does it always translate into access? We question ourselves, we work with our partners, we work with authorities to understand how can we expand access? How can safe abortion be available to everyone? To everyone includes adolescents, young adults, and gender diverse people. So for our movements, our global actions and our global movements, we gather around global days. We call for public sector strengthening, increased access to abortion, better awareness, mass campaigns, and simply viewing abortion as healthcare. We are often challenged when it comes to why is abortion healthcare. We talk about abortion under the bigger umbrella of universal access to healthcare. But does it really work? And what are the challenges around it? The challenges are that the international community, the international policies, or even the local context, local governments do not view abortion as a healthcare service. So what we need to do about the horizon that Augustina added, and asked that we need to harness storytelling. We work with activists, feminists. We engage with multi-stakeholders, young people, policymakers, budget holders, and the global community. The issue in the global south is multifaceted. We also have poor budgets for SRHR, and there are many countries where there is no defined budget for SRHR. Then there are countries like India where there is defined budget only for service provisioning of contraception, medical contraception access, not even access to contraception over the counter. So what do we need? We need more defunding healthcare. We need to go beyond restricted abortions. We need to talk about STIs. We also need to talk about access to modern methods of contraception. Today is the 26th. Today is also the day for World Contraception Day. So contraception and abortion, they are interlinked to a certain extent. We have often found that without the access to contraception, a dignified, non-judgmental, safe access to contraception, often it leads to unsafe abortion. And when a country or when a government bans abortion, it does not stop abortion. It just makes it unsafe by multiple times. All the abortions go under table. Abortion seeker has to not only go through a very isolating and a traumatic journey, but also it becomes cost intensive. What we are witnessing nowadays is that abortion rights, the anti-choice movements against abortion rights are not just in offline media. It's not in like actions. It's not just a person coming in a conference room. We are increasingly being attacked on digital spaces. Abortion providers are being attacked. There are instances of safe abortion clinics being raided, unnecessary fear of environment and intimidation created. We need to educate on the language on abortion as well, the way media reports abortion. And it is, I think, common across all the contexts that all of us are working on, is that media often correlates abortion to judgment. All abortion stories that come out in the media, they often are riddled with judgment. They often equate it to murder. They always talk about the fetus before they talk about the bodily autonomy and the choice of the abortion seeker, the person standing in front of them. So what are we doing for September 28th? Thank you again, Clacai, for organizing this webinar. And similarly, we have many such actions happening with our partners. We are organizing forums, mobilization dialogues, solidarity activities with partners, harnessing the power of storytelling by sharing inspiring abortion stories, stories of mobilization, and stories of gains from different contexts. I know the situation sounds very gloomy, but there are certain contexts where we have made progress, and it's important to talk about the progress so that it is inspirational, so that we can all draw from the knowledge of the movements that have seen progress. We are using art in mobilizations through entertainment, music, dance, artworks, and poetry. We are challenging stigma through conversations, creative activities, and information campaign. And of course, we are working with the communities, and we are engaging with them in order to make sure that, the stigma and the demystifying of safe abortion narrative reaches the last mile. This year, very happy to share that we had more than 100 partner organizations across the globe participating in the global dialogues. And the certain themes that emerged out of the global dialogues are that governments are diverting massive funds into militarization and surveillance, which we need to demand to be well spent in investment in healthcare, which emerged as a major theme in our global dialogues. We also saw in 2025 abortion was authorized on request in 77 countries and in 12 countries for broad socio-economic reasons. However, in many of these federal states, such as United States, we saw legislation varying from one administrative region to the other. And yes, that's all we are doing. And I think, this is the time more than ever when we need to all stand in solidarity with each other. We need to have more conversations with each other. We need to identify the levels of outcomes, levels of interventions that each one of us can do, and absolutely not duplicate each other's efforts. We need to demand for public sector strengthening. We need to demand for expanding access to abortion. We need to demand for more midwives being allowed to provide safe abortion. We need to call for demedicalization of safe abortion services. So I stop at that, and I'm here for any questions that you may have. Thank you.
Thank you very much. Muchas gracias.
Okay,
Ahora
so thank
tenemos
you.
a Lenny
Now
Brown,
we have
para presentar la perspectiva desde
now we have a perspective from ACT. And it says in the chat, we can leave your questions or comments. And there's a question.
Lenny, are you there?
Okay, lady, are you there?
Hello, everyone. I hope you can hear me clearly. Okay, thank you so much. And I thank the speakers that have spoken earlier because you've made my work a little bit more easier by setting the context. But before I even go into present the African context, I would like to thank Clacai again for making this possible, for making sure that the Global South voices, and these are the people that are mostly impacted by the burden of unsafe abortions, are able to come here on the platform and speak freely. So like the theme is globally on abortion being healthcare, I think I will anchor my discussion there, but also will share the context of Africa, what challenges we are facing, and what opportunities exist, and what we have done as Afya na Haki to alleviate these challenges. But first, I know Haki was introduced earlier, but I just wanted to add a few tidbits to that. So Afya na Haki again is an African research and training institute that enhances capacities of African individuals and organizations in health, human rights, and sexual reproductive health and rights. Of interest to this conversation today would be our program, that we are implementing. It's called Litigating Reproductive Justice in Africa. And you can already tell that through our work, our focus is on safe abortion. And we use the framework called reproductive justice. And this framework seeks to find a converging point between the human rights-based approach, but also social justice. So we don't really just look at the normative legal framework, but also the social, economic, and cultural environment, like one of the speakers spoke about. So Africa is not any different from the other countries that we've had, like India, or even countries in the... Yes.
Sorry, Lenny, so sorry. Just we could stop for 1 second. I think they're having a problem.
Oh, okay.
You can proceed now.
All right, thank you. I'm not quite sure where I stopped, but I'll try to my thoughts. I think I stopped at the point where I was saying that we prefer to use the reproductive justice lens, which combines a human rights approach and a social justice approach. So we do not come at the issue of abortion from just a normative perspective, but we want to look at the social, economic, and cultural underpinnings of this issue. And so Africa is not different from the other countries. We have enabling legal frameworks that would actually allow for access to safe and legal abortion. For instance, we have the African Charter on Human and People's Rights, which provides for health as a right. It also provides for things like non-discrimination. The African Charter goes ahead to create a commission, the African Commission on Human and People's Rights, which again went ahead to promulgate the African Charter on the Rights of Women, a protocol to the African Charter on the Rights of Women in Africa. That is the Maputo Protocol. I'm sure many of you are very well conversant with the Maputo Protocol. The Maputo Protocol is one, I think it's the only document on a regional scale internationally that specifically provides for the right to safe and legal abortion under its 14th chapter. Unfortunately, there are some countries, including Uganda, where I come from, which have placed reservations on the provision that provides for safe and legal abortion. And this actually sits into the national legal frameworks that are now governing the provision of the service of abortion. Why am I bringing up this? I am bringing up this to simply make the point that even though at the regional level, there is a semblance of progressiveness, in the national level, there is criminalization of access to safe and legal abortion. And how and where does this problem come from? That takes me to our first challenge. So on the African continent, our biggest challenge is colonialism and the remnants of colonization. Because the law that in Uganda, for instance, the law that we use to regulate safe abortion, is it even a law that regulates safe abortion? Rather, it's a law that criminalizes safe abortion. That is the Penal Code Act. It was enacted in 1950. In fact, it was a copy and paste. We just picked it from our colonizers in the UK, in England, and transplanted it into the Ugandan context. And that penal code is the same for countries like Malawi, Zimbabwe, even some other West African countries. So as you can see, our problem comes from colonialism. And even though the colonialists have advanced in their laws, Africa still retains those laws. And now the problem is that now those laws are being interpreted as African culture, which it isn't, you know? So again, that brings me to the second question of over-essentializing culture, saying that culture prevents us from accessing safe and legal abortion. And yet, even from the research that we have done, countries like Ghana, in the Akan people, they were doing safe and legal abortions way before time. Although now the way they were doing their abortions is considered today as unsafe abortion because they were using herbs and things like that. And later I will speak about a recommendation on how to harmonize the traditional knowledge and the mainstream knowledge that we now have codified under the WHO. So beyond that, criminalization is one of those issues. And now that has also led to incarceration. So because the law is restrictive, the law criminalizes accessing the abortion service. It criminalizes the service provider for even providing this service. We find that sometimes law enforcement officers now end up arresting women and girls who access safe and legal abortion, but they also arrest the service providers that provide the abortion service. That's one challenge. Our other challenge, again, is the fact that even where there are laws, the laws are not in harmony with the policies that governments implement. For example, we have a policy in Uganda that allows for post-abortion care, but we have a law that penalizes access to safe and legal abortion. So many times, service providers use the post-abortion care guidelines to provide their services. But again, like I said, the law has a lacuna. It only provides for a defense for a service provider. So why is this a problem? This is a problem because now some service providers, instead of using the policy guidelines to provide the services, they will refer to the penalizing law to say that, no, the penal code does not allow us to provide the service, even though the clinical guidelines allow us to provide the service. So they usually put up arguments like conscientious objection. So that's also a challenge that we have that prevents women and girls from accessing safe abortion services. Another issue that we face as a challenge is the geopolitical challenges. And for this particularly, I will reference the Donald Trump executive orders and particularly the global gag rule and how it has affected funding, but also implementation of access to safe and legal abortion in many African countries. So I'll use an example, and this even extends to things like HIV funding cuts. Let me give you an example. For in Uganda, PEPFAR is a fund that was, giving a lot of money to Ugandan Ministry of Health clinics that were providing services, including post-abortion care. But with the coming of the Trump executive orders, PEPFAR has asked Ministry of Health and the facilities in which these services are provided not to provide abortion care services, even though this is an HIV fund. So you see that when the global north makes harmful policies, they affect Africa because most of the funding for health and in particular safe abortion comes from the global south, and therefore they call the shots. Then another issue that I would like to speak about as a challenge is the fact that we also have patriarchy still alive. And my colleague from India has already extensively spoken about patriarchy and how the masculine legal system thinks that they should be policing autonomy of women and girls, and therefore deciding when, how to access the abortion service. And now this even ties into the conversation of who holds the resources. Many times, as you will see on the African continent, majority of the poor are women. So because women also do not hold the resource basket, they are also unable to access the abortion service and when they need. And unfortunately for Africa, rich women who can afford the money to access safe and legal abortion know where to find it and they can access the service. But because poor women do not have money or resources to access the service, and these services that would have been offered to them free of charge in government health facilities are being prevented from accessing them because of global health policies, you see the intersectional issue and how this issue is compounded into a poor people problem. And it exacerbates the marginalization of poor women. So I know I have thrown very many spanners and challenges there, but I would like to give you some some confidence that we are not seated as activists on the continent. We are devising means on how to deal with these challenges. Some of the things that we are pushing for is decriminalizing these laws that are penalizing access to safe and legal abortion. And how are we doing this? I will specifically speak about AHAKI. I already spoke about our litigating reproductive justice program. And our focus is using the law to, attack and decriminalize penal codes that limit access to safe and legal abortion. And we do this through filing constitutional lawsuits. Again, I will use Uganda or even Malawi. The constitutions of these countries provide for access to health. They provide for rights of women and their right to freedom from discrimination in whatever form. That includes they have the right to access safe and legal abortion, but we still have laws that penalize that access. So what we do is we go to court to say that a provision of the Penal Code Act that criminalizes access to safe and legal abortion is unconstitutional because the Constitution provides for a whole range of rights, which includes access to safe and legal abortion, but these are not being received. Another legal intervention that we undertake is we have I overshot the time? Oh,
Yes.
sorry.
She goes, yes, a couple of minutes actually. So if you could maybe just wrap it up. I'm so sorry for that.
Oh, I'm so sorry, Eva. I think the conversation was very interesting for me, but let me wrap it up. So we also do constitutional lawsuits, but what we also do is defend providers and women who get arrested for accessing safe and legal abortions. So we have a whole range of things there that we do. But then we also encourage conversation through barazas. I know Rios and Force Feminista has come up in the barazas where we collect people from stakeholders from the SRHR context to speak about these issues and devise strategies on collectively moving forward. We also use art. We use investigative journalism where we get journalists to go and investigate certain issues and document those, and that evidence we use in court for litigations, among other things, including mentorships and all those other related issues. We also have an alliance where people come together and share expertise and knowledge and strategies as well. I have a lot more to say, but let me stop here. In case I get another opportunity, I will come back to add on to that. Thank you so much. Over.
Thank you so much, Sharon, and so sorry. It's just that time has been implacable. So we will now let Said Lachela from Arrow will talk to us about the Asia region.
Yes, hello everyone and good day. I'm Saira Cherla and I work as the Deputy Executive Director at Arrow, and Arrow is a regional women's organization and we are based out of Malaysia and work across the Asia and the Pacific region. Our focus of work is sexual and reproductive health and rights and gender equality, with specific focus on access to safe abortion and comprehensive sexuality education as well. So, the previous speakers have also touched upon the Asia region. And generally, in terms of the overall geopolitical context, we would say that abortion technically is broadly legal in the Asia region. However, as this was also said by the previous speakers, women and girls actually face barriers in obtaining safe abortion access. Now, what are these barriers? Number one is lack of knowledge on the legality of abortion among service providers, but also among women and girls. We also have difficulty finding, providers who are willing to perform abortion, and they have their own biases and values, as a result of which they do not provide abortion. And then health facilities, which are substandard quality, and they we don't have, who don't have access to, provide abortion services. And overall, the context of abortion in the region is stigmatized. So, and that is the biggest barrier. The other key aspect that we also see is that data on safe abortion access is very limited. We have data that is as old as 2014, 2015. And based on that data, we see that at least 27% of pregnancies in Asia, they end up in abortion. And about 4.6 million women in this region are always treated with complications as a result of unsafe abortion. What we also see is within maternal deaths, at least 6% of maternal deaths are as a result of unsafe abortion. And the need that we have is to position safe abortion, within the comprehensive SRHR, maternal health services, and the Sustainable Development Agenda framework, which will then enable access. The two speakers have all talked about, the challenges that we all face, and that is similar within the Global South context. And what I can focus on is in terms of how to strengthen the collective momentum around access to safe abortion, which is one of the questions that has been asked. And very recently, we organized a convention of SAGE. SAGE is a Safe Abortion Advocacy Initiative, a Global South engagement. This is a Global South engagement of safe abortion organizations across Asia, Africa, Latin America. And partners have actually come together and they have proposed certain solutions. Now, some of the solutions, especially in the era of anti-rights, anti-gender, and lack of access to safe abortion services, some of the solutions and way forwards that this group of people have put forward is, number one, to broaden the stakeholder base, to broaden the support base of different stakeholders, as we are seeing a rise of anti-rights and religious authorities. And when we talk about a strong, broader stakeholder base, and this can include governments, it can include civil society groups, it can include professional associations such as the Midwives Association, FIGO. So, once you broaden the stakeholder base, you have more people working towards the cause for access to safe abortion. And in line with this, the second point is more and more inclusive, strong cross-sectional movements and alliances for safe abortion. And here we are talking about broader social movements, human rights movements, climate movements, digital rights movements, who can also come and be part of the advocacy for the right to safe abortion. And another point that was also brought by this group was in terms of, how access to safe abortion can fit into the broader universal health coverage agenda, and how we can actually push for right to safe abortion within these larger right to health spaces. And one point that was also brought in this convention was about how we can be intentional and of the inclusion. It cannot be just ad hoc, but we have to consistently build these strong cross-sectional movements. The other strategy that this group brought out was in terms of evidences and facts. And in my introduction, I have just said how dated is the data. We hardly have data on what is the rate of abortion that is there, and how we need to focus on generating data. And we have seen in the past that rights-based, facts-based data can actually go a long way in terms of convincing legislators and decision makers. And the one aspect is quantitative data, but also I think we should be focusing on powerful narratives and testimonials, so that these narratives and case studies that can actually, in terms of qualitative data, can also support access to, safe abortion. So these, in terms of data, these are some of the points that have been brought about in the discussions in that convention. Then again, another strategy that has been brought out is in terms of monitoring, and we are all facing the anti-rights movement. And to tackle disinformation, what is important is also to be proactive. I think all of us are talking about not to be reactive, but proactive. Monitor the opposition, be proactive with your strategies, and then take decisions and move forward. And also collaboration with our colleague from Africa has talked about how collaboration with legal organizations is important, and that is again quite important in terms of litigation and posing rights-based arguments as part of monitoring and tackling disinformation and misinformation. The health system strengthening strategy was also something that was brought out, and how working with the health systems, the health service providers, can also be a good way for us to advance the law and policy frameworks, advance the financing, human resources framework. Arrow, together with our partners, we implement this Kaleidoscope initiative, and this initiative is working. It's a transnational feminist movements coalition. It includes WGNRR, it includes Mama Network, Global Fund for Women, and in Asia and Africa, we are trying to use the health system's entry point in order to advance the right to safe abortion. Again, documentation has also been, a key point in terms of as a strategy for us to advance the law and policy framework in our respective countries in the global south. And most important, and that being, donors to ensure that safe abortion organizations are funded. So these are some of the resistance tactics in terms of the strategies that I have just presented. And these can actually help us move forward and move the needle to access safe abortion, advance reproductive health, rights, and justice. So I will stop here. Thank you.
Muchísimas gracias por su participación. Le cedemos la palabra a Georgina Epure.
Thank you so much for your participation. We'll let Georgina Epure talk now about the European region.
Thank you very much. I hope you can all hear me. Thank you to the organizers for inviting me to be part of this panel discussion, and for the opportunity to share some thoughts and perspectives from Europe with you today. I am Georgiana Epure. I represent the Center for Reproductive Rights, which is a global human rights NGO that uses the power of the law to advance reproductive rights as fundamental human rights across the world. I worked with the Europe program as an advocacy advisor for Central and Eastern Europe. And together with my team, we've been working with our partner organizations across Europe to advance and protect reproductive rights, including abortion rights. For today, let me start with a quick overview of how abortion is regulated in Europe. And then I'll outline the big changes we've seen over the past decade, and then share some thoughts on the challenges as well as opportunities that lie ahead. It's important, I think, to start by saying that from the start that for decades now, Europe has moved steadily towards legalizing abortion and removing restrictive laws and policies. Just this week, the Center released a new report on abortion laws across Europe. It is available on our website, and my colleague Christina will also share the link to the report in the chat box. I'm flagging it because, as this report highlights, right now abortion is legal in almost all European countries. Most countries in Europe allow abortion on request, at least in early pregnancy. And that means, to be more precise, that 43 out of 49 countries in Europe allow abortion on request. Only 5 countries in the region still maintain highly restrictive abortion laws. And these are Andorra, Liechtenstein, Poland, Malta, and Monaco. However, even in countries where abortion on request is legalized, various harmful regulatory and procedural barriers to care are maintained. And these range from mandatory waiting periods to requirements regarding bias counseling, criminal penalties, restrictive time limits, and financial barriers. Now, having said that, even in countries where abortion, in these countries and in the region, in the past 10 years alone, what we have seen is that 20 countries across Europe have enacted reforms to improve access to abortion. Since 2018, 6 countries and jurisdictions in Europe have legalized abortion on request. And others have removed waiting periods and counseling requirements. Countries like France, Luxembourg, the Netherlands, North Macedonia, and Spain. And other countries have extended timeframes for abortion on request, like Denmark, France, and Norway. And several others have removed other barriers or expanded access to medication abortion. And this momentum continues. Over 10 countries, as we speak, are considering reforms to improve access to abortion care and bring their policies and laws in line with international human rights and public health standards. Now, while this trend is overwhelmingly progressive, at the same time, there are challenges, and the risk of regression remains a concern. In the past decade, 9 countries in Europe have passed measures that restrict abortion access. For instance, Poland removed a ground for legal abortion. Hungary introduced a requirement for women to listen to fetal ultrasound prior to abortion care. And again, as an example, recently Moldova banned the use of telemedicine for abortion medication. And there are more other examples that are highlighted in the report we just published. Another challenge across the region, which has been mentioned by the other speakers, is the presence of anti-rights actors that are more and more emboldened and well-funded. They are using similar tactics, ranging from advocacy and campaigning to litigation and spreading misinformation about abortion care. And as it has been clear to all of us, these are efforts that are part of a broader attack on sexual and reproductive health and rights that we have seen across the world. And on top of this, what we are seeing in Europe is also that NGOs and human rights defenders working on sexual and reproductive health and rights are increasingly facing judicial and administrative harassment, intimidation, and smear campaigns. So where does this leave us? Moving forward in this context, as Sai also underlined, it's important to push for progressive legal and policy change while staying alert to regressive attempts. But continuing to have this progressive agenda is more important than ever, and protecting access to abortion as essential healthcare is the most effective way to counter the anti-rights agenda. So to that end, we need to make sure that decision makers who are committed to reproductive rights stay vigilant, protect existing access, and they themselves continue to improve laws and bring them in line with international human rights and public health standards. And for our movement, which has such a crucial role to make sure that Europe continues to move forward, this all means that we need to work closer together at both national and regional level to build effective strategies that preempt regression and advance protections for abortion care. And of course, to keep an intersectional lens in everything that we do, looking at how gender, sexual orientation, class, race, migration status, and other factors shape how people experience access to abortion care. And without doing these reforms, risk leaving people behind and reinforcing inequalities that already exist. So in short, to conclude, the situation in Europe gives both cause for optimism as well as for staying vigilant. And I pause here and I'm happy to answer any questions if there are.
Gracias, Georgina, muy amable. Aprovecho para disculpar que Agustina
Thank
tuvo
you,
que
Georgiana. Very
desconectarse
kind of you.
y
Sorry,
representando a
Gina had to
Ahora le
disconnect.
toca
Now I'm representing
Latinoamérica
myself, and now it's
estoy
Latin
acá en mi
America,
rol de coordinadora de
and
la
here
red
I am as
jurídica de
coordinator
Clacai. Quiero
for Clacai.
iniciar hablar de
So
Latinoamérica
I want to start by talking about Latin
poniendo sobre
America
la mesa
by
que
putting on the
nosotros
table
estamos
the fact that
observando en
we
la
are
región
observing
una
in the
deliberada
region
restricción
a
del espacio
deliberate
cívico.
restrictions of the
Países
civic
como El
space.
Salvador, Venezuela,
Countries such as
Nicaragua
Salvador,
están
Venezuela,
enfrentando
Nicaragua
desapariciones
are
forzadas,
facing
detenciones
forced
arbitrarias,
disappearances, arbitrary
normativas
detentions,
restrictivas que
regulations that
limitan el trabajo
restrict
de
and
las
make work
organizaciones de la sociedad
of
civil,
civil
leyes
society organizations harder,
anti-ONG, en las que también
anti-NGO
tenemos que
laws,
mencionar
where
países
we
como
should
Perú
mention
y
also countries
otros,
like Peru and
y cómo
others,
eso está
and
generando un
how this
ambiente
is
de temor
creating
que
an
afecta
environment of fear
especialmente la
that is
defensa de los derechos
specifically
sexuales
affecting
y de los derechos
the
reproductivos.
defense of
Hay una
sexual and
restricción
reproductive
de
rights.
financiamiento que
There's
agrava la situación
restrictions on
porque
financing
significa
that
que las
makes the situation
organizaciones
worse
deben
because
hacer
it means
reducción de
that
personal,
organizations have to
cancelación de
reduce
líneas de
staff,
trabajo,
cancel
cierre incluso de
some
algunas
lines of work, some
organizaciones. Y todo esto está
closures of
ocurriendo en un
organizations. And
contexto
all this is happening
en
in a
el que, según
context in
Latinobarómetro,
which, according
la
to the Latin American
población
Barometer, the
en lo que
population,
perciben como sus
in
principales
what they
problemas
perceive as their
está la
main
situación de la
problems,
economía, el
they
desempleo,
are
la inseguridad,
naming
la
the
corrupción.
economy,
Y en
unemployment,
consecuencia
and
se
corruption.
evidencia que muchas
So we
personas,
see that there is
posiblemente
evidence
con
that many
razón,
people, possibly with
priorizan
reason,
la supervivencia material por
prioritize
encima de la
material
defensa de
survival
derechos,
over
a pesar que
over
esta
defending
misma
rights, despite the fact
encuesta
that
evidencia
this
que
same survey
persiste
shows
una
that
insatisfacción
there
con
is
la
a
desigualdad
persistence of
y la falta de
dissatisfaction with
justicia.
inequality and a
Si
lack of
esto lo
justice.
unimos a
If we
el
join this
tema
to
de
the fact that
la validación de la democracia, la
validation of
misma encuesta nos
democracy,
habla de que un
this same
52% de la
survey tells us
región
that
tiene quien
52% of the
cree, quien
region
confía en la
believes,
democracia y que
trusts
está
in democracy,
creciendo
and
la
that
desconfianza
there's
institucional
a
y que más
growth
del
in
50% de la
institutional
población
mistrust, and that over
considera
50%
aceptables
of the
enfoques
population
autoritarios
think that
si se
authoritarian
garantiza con
approaches
ello
are
cierta
acceptable if
seguridad.
these can guarantee certain
Y
safety.
lo que llama
And
más la atención es que esta
what
asociación de sistemas
gets what is most
autoritarios
noteworthy is
se
that
da principalmente
these
en la población
authoritarian
joven,
leanings
lo
are
que
usually
está
in the
evidenciándose
young
como un
populations,
problema.
which is
Y
posing a
ese
problem.
problema se
And this
está siendo
problem is being
abordado con
fertilized
mucho
with
sazón
lots
por discursos de
of
políticos muy
a
visibles en redes
geopolitical
sociales que
discourse
promueven la
that
defensa de la familia
promotes
tradicional,
the
pongo
defense of traditional
entrecomillado el
family.
tema de
I
familia
put
tradicional,
traditional
y
family in
atacan
quotes,
de manera
and
muy
they
agresiva
are
a quienes defienden
aggressively
derechos.
attacking those who defend
En ese
rights.
marco
So within that
de ese marco
framework, within this
biopolítico,
framework of
la
this
autonomía de las mujeres y su ejercicio
biopolitical
se está presentando
game,
como si fuese
the
un enemigo de la defensa de la vida.
those who
Y
defend
esto
women's
ha
rights are
conllevado
shown
incluso
as
a que muchos
are portrayed as
activistas han
enemies
tenido
of
que
life,
reducir
and so
su
many
presencia
activists
en
have
los
had to
espacios
reduce their
públicos
presence
o
in public
salir de sus
spaces or
países por
leave their
persecución y
countries
por necesidad de
due to
protección.
persecution and due to a need to
Sin
protect
embargo,
themselves. However,
con esta introducción
with this introduction, I don't mean to say that the outlook for the region is just marked by reversals. We also have great lights of hope. I would like to first mention what I've always, since this phenomenon began, I title as a wonder, which is the green tide, this huge, powerful feminist movement, an epicenter of transformation and of conquering rights that has managed to install in the public agenda the debate on decriminalization of abortion as an issue of human rights. And there is there's clear progress, such as Colombia recognize abortion as a fundamental right, Argentina abortion till week 14 in Uruguay, Mexico legal abortion, safe abortion since 2021 with a gradual process in the states. But I speak of these successes, but I must point out some very worrying situations. So, for example, Guatemala has seen an increase in abortion penalties. Dominican Republic, in its very 2025, approved a penal code that keeps complete criminalization of abortion, and Honduras constitutionally shielded the provision with no exceptions for abortion, basically a very set in stone clause. And so there is a complex reality in Latin America. And despite these complex realities, there is information that talks of abortion incidents being similar in countries where it's legal, 41%, as in countries where it's forbidden, 39%. And that the difference is chiefly in the safety of the people having abortions. So unsafe abortions are a cause for maternal mortality that is avoidable. In our region, every year we see 670,000 unsafe abortions between teenagers from 15 to 19, according to population funds. Thus, we have to demand that states see the situation of abortion from a different window. From this lens, I am convinced that decriminalization of abortion is a gradual but inevitable process because it cannot continue being validated from the state having the deaths of women due to conservative resistance because of absolute provisions, because of stigmas and inequality in access. There are large opportunities that can be seen in legislative progress, jurisprudence progress, linking of our networks, the strength of what I already mentioned in the green tide and just causes, the feminist movement, and scientific evidence built on arguments that more and more back our cause. So there alone, just what I see as a perspective that the road is built with that constant articulated mobilization that we have achieved and that we must continue getting with strategic litigation in national and international tribunals, with political and diplomatic activism based on human standards and human rights standards, and educating. Continue the task of avoiding the stigmatization of abortion. Affirm that abortion is health, it's justice, it's dignity. There is concrete proof where in Uruguay, the voluntary interruption um, law reduced to zero deaths by unsafe abortion. So to conclude, I would like to carry out a very brief reflection on political philosophy using John Dalp, who is a jurist that anti-rights people more or less respect. So he sets out some principles of justice that remind us that from the veil of ignorance, any woman, any person could be a woman, poor, victim of violence, or face unwanted abortion, and that alarone it gives us the right to decide because it guarantees autonomy faced with unequal circumstances. And within that logic, absolute criminalization imposes a single moral and it affects mostly poor women and contradicts the principle of difference that is supposed to benefit those who are least favored. So decriminalization, it has to guarantee equality, justice, and a pluralistic society. Abortion has to be seen not as a privilege, but rather as an essential right. And that's where what leads to this activities like this one, to continue making global articulation happen, to give back autonomy, to allow for free development of the personality, dignity, health, and freedom. So that is why we have the greatest security that from here, from spaces such as this one, unstoppable, present with unity, and always strengthening our voices, Latin America is going to achieve having legal, safe, and free abortions. Thank you very much for listening to me. And now I will go back to the role of moderator, given the absence of Agus. And I'd like to present the North American vision. And we have now Rebecca Reingold speaking, who, like we said, is from the O'Neill Institute.
Muchísimas gracias. Good morning and good afternoon. First, I would like to thank Clacai, the other co-hosts and the organizers of this forum, for the invitation and the opportunity to share a bit about what has been happening in the US related to abortion rights. Given that I'm a lawyer, I thought I would focus my remarks today on the main legal challenges facing abortion rights here and the opportunities that law and policy offer us during these challenging times. As you may well be aware, the US is facing a multitude of attacks on abortion rights in this moment, from the courts to the legislatures to, of course, the Trump administration. Given our limited time, I will briefly reflect on the role that courts have played in creating the current patchwork of abortion laws we see in the US today, as well as the heightened risks that recent threats to progressive civil society organizations pose for the abortion rights movement. Now, courts in the US have long played an important role in establishing the boundaries of abortion rights. In the wake of the Roe v. Wade decision, federal courts were the main vehicle for determining which state-level abortion restrictions went too far, violating our federal Constitution's right to abortion. When the US Supreme Court overturned that right in the 2022 Dobbs decision, it ostensibly returned the issue of abortion to the states. However, federal courts, including the Supreme Court, have played no small role in sorting through the complex legal landscape that has emerged since. They have been asked to weigh in on our federal regulatory bodies' authorization of mifepristone, the scope of federal obligations to provide stabilizing care during obstetric emergencies, the viability of federal privacy protections for reproductive health information, and the legality of restrictions on interstate travel for abortion, just to name a few examples. And in this context, some federal courts have issued truly alarming decisions, many of which reject scientific and medical expertise and buck long-standing legal precedent in the process. And while the Supreme Court has sidestepped the substantive issues in its most recent cases involving abortion, the justices from its conservative majority have indicated a willingness to further chip away at remaining abortion rights in various decisions. In particular, we see real risks that they could restrict access to medication abortion, expand the scope of religious refusals or conscientious objection, or eliminate the judicial bypass requirement, which is currently the pathway that young people in the US use to access abortion care without parental involvement in many states. While many experts do not think this Supreme Court is willing to go so far as to impose or uphold a national abortion ban, it is certainly poised to issue decisions that would create additional barriers and make it even harder to access and practice. However, I don't want to only give us bad news. So I do want to highlight two trends in the US that provide hope in the context of a federal judiciary, at least at its highest levels, that has shown a reluctance to stand up for abortion rights. First, we have the role of state courts in protecting and advancing abortion rights post-Dobbs. State courts have long played an important role in grounding abortion rights in their respective constitutions. And since 2022, numerous state courts have been returning to their longstanding precedent that grounds a right to abortion in various state constitutional rights, including, but importantly, not limited to, a right to privacy. Other states have newly interpreted their constitutions to afford broad protections to abortion care and other reproductive health services. A handful of state Supreme Courts, moreover, have pushed back not only on the Supreme Court's ultimate holding in Dobbs, but also its reasoning. The Dobbs decision infamously relied on the country's history and tradition as a basis for assessing the right to abortion, a theory of constitutional interpretation also known as originalism. And various state court judges, in turn, have criticized this embrace of originalism for various reasons, including the fact that it binds the US to outdated values and reinforces the subordination of marginalized groups. It also serves as a pretext for what we know to be a subjective value judgment. Second, we have seen the US abortion rights movement diversify the law and policy strategies it relies upon to advance abortion access in this new legal landscape, moving beyond litigation. For example, the movement has turned to state ballot initiatives, which seek to amend state constitutions so that they explicitly protect the right to abortion. Since Dobbs, voters in 10 states have passed constitutional amendments to protect abortion rights. The movement has also worked with state legislators to pass various state laws seeking to address the legal uncertainty and confusion that has emerged based on the fact that the legality of abortion now varies significantly by state. With more and more people in states with abortion bans relying on interstate travel to access care, anti-abortion government officials have begun threatening to apply their abortion bans across state lines. And in response, we've seen creativity and innovation as advocates and legislators have passed what are called shield laws to protect abortion providers, helpers, and seekers in states where abortion care is permitted from legal attacks by anti-abortion state actors. Abortion rights and the movement behind it are now also under attack due to the broader threats to the rule of law that the US is currently facing. While the attacks on civil society and its ability to support progressive movements have certainly increased since Trump took office earlier this year, some were already underway in 2023. That year, we saw the American Alliance for Equal Rights initiate a lawsuit in Georgia against a funder on the basis that it provided grants to organizations owned by Black women. Now, the parties in the lawsuit eventually settled, but the arguments in that case foreshadowed a troubling legal scenario, namely that philanthropic organizations and individuals could be restricted in funding causes that align with their values, including efforts to support historically marginalized groups. Since Trump took office, that same organization has formally requested that the Federal Internal Revenue Service open investigations into various philanthropic organizations based on allegations of racial discrimination. Trump has also threatened to take away the tax-exempt status of other organizations based on their work on immigration or gender-affirming care, among other politicized topics. Finally, and most recently, in the wake of the Charlie Kirk shooting, the Trump administration has hinted at an executive order that would crack down on philanthropic organizations to support a range of progressive movements. Organizations in the US that provide, advocate, fund, or otherwise support abortion care will no doubt be targeted as part of these broader attacks on civil society. And it is no secret that these efforts could also affect the work of abortion rights advocates working in countries all around the world, like you all. Trump's attacks against and the crackdown on progressive civil society organizations will no doubt end up in court, like much of the actions taken by this administration in the last 9 months. And while his actions in this arena, like so many others, are clear violations of the law, people are beginning to lose faith that the federal courts will serve as a check on the illegal exercise of executive power. While what is unfolding in the US now may feel new and unfamiliar to many Americans, it does not for those of us who have lived or worked in other parts of the world. We know that this struggle is not unique and that there is so much we can learn from the experiences of our peers in other countries who have combated similar threats to rule of law, defended the essential work of civil society, and operated under and eventually overturned harsh abortion bans. So looking outside of our borders is what really gives me hope during these challenging times. Your strength, resilience, and solidarity is truly a source of inspiration, not only for me, but also I think increasingly for other abortion rights advocates here in the US. Thank you.
Gracias, Rebeca, por tu
Thank you,
intervención.
Rebecca, for your participation here.
Creo que hemos
I
tenido
think we have
brillantes
had brilliant
que nos permiten tener
words
un
and that have
panorama
allowed us
global
to get a
sobre el
global
aborto. Tenemos un
outlook on
tema
abortion.
de
We have
tiempo,
a
el
constraint with regarding to
Hay dos
time,
preguntas
our
en el
merciless
chat que
adversary. So
lo que
and we
les
have a
voy
couple
a
of questions in the
ofrecer como
chat that what I will
personas
offer the people
y
who
que se
made
van
those
a quedar
questions is that
como
they will
tareas
be left
pendientes para
as
los
homework
webinarios que
for
realizamos
the webinars
regularmente en
we
Clacai.
carry out
Una es
regularly at Clacai. One
los
of them
desafíos
is
que han tenido en
the
particular con
challenges
respecto al rol
that
de las
these
iglesias en
organizations have
cuanto
faced
a
with regard to the
aborto
role of
y derechos
churches when it comes
sexuales
to
y
abortion
reproductivos
and
y
sexual and
cuáles
reproductive
narrativas se han
rights, and
implementado
what
para ir
narratives have been
contrarrestando
implemented in order
discursos
to
o modernos
counteract
a los derechos humanos.
opposing narratives.
No tengo el link aquí, pero incluso
I
hay
don't
un
have the link
webinario
here,
que ya
but
tuvimos en
there is a
Clacai
webinar
donde hablamos sobre
at
esto.
Clacai
Podemos
where we talked
compartirlo
about this, and
para
we can share
que
it
se
to
difunda. Y
disseminate
otra
it.
pregunta que
And
también salió en
another
el chat
question that we
es,
have in the chat
en un
is,
contexto cada vez más
in a
restrictivo de
context
derechos
more and
sexuales y
more restrictive
reproductivos,
for
¿qué
sexual and
narrativas
reproductive
han
rights,
usado?
what narratives have you
Como
used
campañas de comunicación.
for
También tenemos
communication
webinarios
campaigns?
que
We
donde
also
hemos
have
trabajado narrativas.
webinars where we've
También
worked
los seguiremos poniendo
on
para en el
narratives. We'll
próximo,
continue
porque
uh,
siempre hay que
showing
profundizar
these
en eso.
because we
Pero
always
les
need to look
recomiendo
more
que
in depth on
vayan
that.
a la
But
página de
I
Clacai,
recommend that you
donde
go to the
están
Clacai website
las
where
grabaciones de los
you have
webinarios y que
recordings
van a
for the
encontrar
webinars because you will
algunas
find
respuestas
some
a esas
answers there
preguntas.
to those
Lamento que no
questions.
podamos
I am so
seguir la
sorry that we are
conversación
unable to
por un
continue the
tema de
conversation
tiempo.
due to time
Quiero
constraints.
agradecer a las
I would like to
organizaciones
thank
que frente a la
organizations
propuesta
that,
de
faced
organizar
with the
este
proposal of
foro, se
organizing this
unieron
forum,
para
joined forces with
una
us
convocatoria de una manera tan
to
entusiasta
gather
y
people in such an enthusiastic
confiando
way
en que era
and
una
trusting
buena
that it
idea que
would be a good
conversáramos.
idea for us to have this
Osio,
conversation.
Ajaki, Ríos, IPAS, ONIL, UED, Centro de Derechos Reproductivos, FOS Feministas, LIRA, WGRR, la Red de Salud Latinoamericana de las Mujeres, que fue la aliada con la que primero conversamos hacer este proceso. Nos quedan
Well, we have
grandes
great, she listed the names of the various organizations. So we
lo que
have great
tenemos que hacer
reflections
en el
on what
mundo
we need to do in the
para
world
continuar
in order to continue
profundizando los derechos sexuales y reproductivos, narrar
analyzing
historias,
reproductive and
estudios
sexual
de
rights in
caso,
depth, tell
narrativas
stories,
potentes y
uh,
positivas,
document
seguir
case studies, come
sumando
up with
personas,
powerful
ampliar las bases de apoyo,
narratives, continue
presupuestos
expanding
públicos y
support
privados
bases,
que
public and private
tienen que tener
budgets that
incidencia
have
para
to
que
have
tengamos el
the
acceso
presence to
anticonceptivo,
be able for us to have
superar
access to
impedimentos y
birth
vacíos legales,
control, overcome
cobertura universal de salud,
legal vacuums,
el
universal
acceso de aborto como
health
cobertura
coverage,
universal de
access to
salud,
abortion as universal healthcare
colaboración,
coverage,
litigio,
cooperation,
argumentación,
litigation,
usar el
arguments,
poder de la ley,
using the power of the
mirar los
law,
casos de éxito, tomar
making sure
en
we
cuenta
analyze
las
success cases, take
intersecciones,
into account the various
aborto, orientación
intersections
sexual y de
between
género, raza,
abortion, sexual and
discapacidad
gender
y
orientation,
otros,
race, disability, and
resistencia
others,
frente a los retrocesos.
resistance vis-a-vis
Si es bien es cierto que, que el derecho al
vis-a-vis
aborto está
defeats.
bajo
And
amenaza,
though it
también
is
es
true
cierto
that abortion is
que
under
el
threat,
derecho al
it
aborto
is no less true
tiene
that the
una
right to
argumentación
abortion
sólida,
has
sólida que
solid
sustenta
backing
la
behind
lucha,
it
que sustenta lo que
that
estamos haciendo,
defends
que
the
sustenta la
fights
exigencia.
and what we're
Desde
doing.
Clacai y
And
sus
so
redes
from
jurídicas
Clacai and its legal
agradecemos
network,
muchísimo
we'd
la
like to thank
participación de todas las
very
personas que
much
se conectaron,
participation of all
de
people who
las
connected,
panelistas que
our
aceptaron
panelists who
con tan
accepted
buena
with
empatía
such good
ser
empathy,
parte de este
be
proceso
part of
y
this process.
hacemos
And
una
we'd like
propuesta
to
final que
propose
nos demos
finally
desde ahora
that we
la tarea de
now
que
give
todos
ourselves
los
the
años en
task of
septiembre
every year
vamos
in
a hacer
September
este
run
balance
this
global
balance,
de
this
cómo
global
hemos avanzado,
summary of what the progress
cuáles
we
son
have
los
made,
puntos neurálgicos
what
a atender
what are the
y
pain points that
cómo
we need to
vamos a
address
superar
and
esos
how we are
puntos
going to
vulnerables con la
overcome
tercera.
those
Porque
pain
estamos
points because we
unidas,
are
estamos
united,
en
we
resistencia,
are resisting,
estamos
we are
indetenibles,
unstoppable,
presentes y
present
siempre
here, and
vamos a
always,
seguir
we will always
fortaleciendo
continue
nuestras
strengthening
voces.
our
Muchísimas
voices.
gracias.
Thank you
Que
very
tengan un
much.
excelente día,
Have an
excelente
excellent
tarde,
day, excellent
excelente noche.
afternoon, excellent
Gracias
evening.
a
Thank
todas,
you
a
very
todos
much to
por
all of
estar
you
aquí.
for being here.
Gracias, gracias a todas. Gracias, Lindalina.
Thank
Chao,
you.
chao.
Thank you.